My name is Jennifer House, and I'm a counselor with the Ascension Employee Assistance Program. And I am welcoming you to our series on compassion fatigue. In these next few segments, we're going to talk about what exactly is compassion fatigue. How does it affect us personally and professionally and in our community? To kick off this topic, I've invited Donna Schmitz, who is also a counselor in the Ascension Employee Assistance Program. Welcome, Donna.
Thank you, Jen, and thank you for having me.
You bet. I would like to kick off by just asking, what exactly is compassion fatigue?
Okay, absolutely. So, compassion fatigue is the emotional and physical fatigue that is experienced from the secondary trauma that our healthcare professionals are taking on when they're working with the pain and the suffering from the patients that they work with each day.
So, the healthcare industry in general, that is a stressful job.
Absolutely.
And I'm going to guess that this year particularly, that it's been even more stressful. Are you seeing that? Are you seeing more compassion fatigue?
We sure are. So we're seeing it in various forms. So when a healthcare professional comes in, they're not presenting for compassion fatigue, okay? Oh. Very seldom would you get someone that comes in and says, oh, I'm suffering from compassion fatigue. That's not what's going on at all. In fact, it's almost alarming to me, Jen, that our healthcare professionals, while they're on the front lines and dealing every single day, taking on that secondary trauma from all the patients that they work with every single day, that they're not more understanding and maybe trained to understand and look for it in themselves.
Okay.
In fact, many of our healthcare professionals, they don't know what compassion fatigue is. They don't understand that every single day when they're working with their patients, they're hearing their stories, and as they hear their stories, they're taking on a little bit more of that pain and suffering, and that is what compassion fatigue is, okay?
So you throw around terms like compassion fatigue, but then I've also heard secondary trauma, vicarious trauma, and then we hear burnout.
Sure.
So can you help us understand now, how are these all related, or how does this fit?
Yes, absolutely. So the difference is when you talk about secondary trauma, you talk about vicarious trauma and burnout. Vicarious trauma, secondary trauma, those are symptoms of compassion fatigue, whereas burnout, that's the result of prolonged and untreated compassion fatigue, okay? So when we work with, take for instance, Jen, a healthcare professional I had in last week. She presented for anger, frustration, feeling maybe a little bit more anxious, and I'm seeing this on a larger scale. I'm seeing this in many of the healthcare professionals presenting right now. So they're presenting concern, maybe anger, frustration, and they admit that I'm just not feeling good towards my patients. When my patients are telling me what their ailments are, I'm feeling judgmental. Guess what? That right there, that's compassion fatigue, okay? And so they, with that understanding, they now can feel like, oh, okay, that is normal. There isn't something wrong with me, because they feel guilty. And they shouldn't be feeling guilty, because it's an occupational hazard to all of us in the helping profession.
Absolutely.
Okay? So the difference is burnout. We want to help those healthcare professionals when they're coming in. So if they're presenting with anger and frustration, I'm going to help them work through their compassion fatigue, and I'm going to help them understand how to use compassion in their jobs instead of empathy. Compassion is having concern for the pain and the suffering of their patients, whereas empathy is sharing right in that suffering. Absolutely. So that's key right there, is just having them understand that that's not their job. They do not have to take on the pain and the suffering of their patient in order to help them. Okay, so I help them take that out of their job. Okay,
Thank you so much.
Absolutely.
Thank you for being with us today.
Yeah, absolutely.
If you or someone you care about is struggling with compassion fatigue, definitely want you to get help before it leads to burnout. If you're struggling with that or mental health issues, relationship struggles that might be affecting you personally or in the workplace, please contact your Employee Assistance Program. We provide short-term counseling and resource referral to help you and members of your household. Thank you.